Hello everyone, hi. Okay, it's me again. Okay, now these are the questions that are being asked by Sibahi to both of the nurses and the physicians. I'll put them all in one because they're almost the same. So, first of all, patient identification. How do you know that the patient that came to you is the same patient that is registered in the computer? So, first of all, we ask the patient his full name. 4 names. الاسم الرباعي. أول ما يجيك المريض لازم إحنا نسأله الاسم الرباعي، وبعدين السؤال الثاني رقم الهوية إذا هو محافظ رقم الملف. Okay, so we have to ask him for his full name. If he knows his file number, that's fine. If he doesn't, then we go to the ID number. So that's number 1. We're finished with number 1. Number 2, turnaround time. We already spoke about that in our previous video. It's in the icon, and you can see it online. It's turnaround time, which is TAT, the time needed to perform a laboratory test. And STAT, that's STAT, but STAT is short turnaround time, the time needed to perform an urgent test. Okay, so we finished that one also. Patient assessment and care planning. The patient should know exactly what the plan is for his treatment. He has to be well educated about it and knows exactly what he's going to do, what he's going to take, and the side effects. So we're finished from that one also. Okay, so reporting of critical value. If there's a critical value, either if it's from the X-ray or from the laboratory, a telephone call should be done from the laboratory or the X-ray to the doctor. And they say the name of the patient, the full name, the ID number, the file number, and the result. Then they ask the doctor to please repeat the information. So the doctor will repeat the name, ID number, and the file number and the result. This is called read back. So if you're asked about Sibahi about the critical reporting values, there's a system or a policy called read back. Okay, so that's about the critical values. Disinfection of patient equipment in between patients. That's done with 70% alcohol. So that's our answer for this. Okay, what to do in case of cardio pulmonary arrest? First of all, if you're in a clinic and the patient, you suspect it's a cardio pulmonary arrest, you have to check for the vital signs. If there's no pulse and there's no breath, you call 1050, which is the reception downstairs. Identify your name and your location and ask for code blue. So the rest is the responsibility of the reception. So again, you check the vital signs, that's your answer. Then you call 1050 and then you report your name and location and ask them for code blue. And then the team will come. By the time the team will come for the CPR, you start your compressions. If you're alone, 30 compressions in 2 breaths. If you have an assistant, it's 15 compressions and 2 breaths. Okay, so we go to crash cart management. They check here for all the checklists. The expiry date of the medications, the number of medication, what's available from the medication checklist for all the medications that are in the crash cart. Medication management and preparation and administration, just like what we did yesterday. They're going to take one of the nurses or 2. Please prepare for us an injection. You have to start with your hand hygiene, wear your gloves, then prepare the injection. After you finish preparing the injection, you go to the patient, you read him his rights, like your full name, your file number, ID number, then you administer the injection. After they're finished, you discard the injection, and then you go and clean up the area where the patient was, and then you take off the gloves in the Sibahi way, and then you wash your hands again. So you have to be familiar with the 5 moments of hand wash. And if there's no recapping, but only if you're like giving a skin test, you can recap. That's one of the conditions that you recap the injection. Rather than that, it's discard. Okay. Then process for patient transfer. You have your all your equipment ready in case of transfer. The form for transferring patient outside the facility, that should be also inside the ambulance. The paper should be signed from doctor and nurse from here, and then doctor and nurse from there, and then stamped from the hospital that received the case. What to do in case of fire? First of all, you if there's a fire somewhere, first of all you rescue whoever's inside, take them out, and then you call 1050 for the reception. Call for code red. You identify your name and your location, and call for code red, and then the rest is the responsibility of the reception. And then you start the race and pass. Of course, you all have this. You all have the card that you're wearing with your ID. With your ID, and we start race and pass. Race is rescue, and then alarm, and then contain, which you try to close the window and stuff something under the door, and then you try to extinguish. You extinguish by using pass. You pull the knob, and then you aim towards the fire, and then you squeeze and swipe. So that's race and pass. Okay. After that, what to do in case of fire? We did that. Process for Staph Sharps injury. In case of injury, what do? First of all, you stick your finger under running water. You don't squeeze it. You wipe with alcohol and put a Band-Aid, and then you report to your boss, and you fill in the form for needle prick. And then you go to the laboratory for further testing. That lasts from 3 to 6 months, just to monitor. If you know the other party, like you've been pricked by a known needle by the patient, that you have to tell the laboratory who it is, identify him. If it's like from the sharp container, that's a different issue. We also report it to the laboratory to take the necessary steps. Effectiveness of point of care. This is called... let me show you here. It's called effectiveness of point of care. Effectiveness of point of care. EPOC. Okay, and this is any test that's being done outside the laboratory, which is the glucose prick. They're going to ask you, how are you sure that your results are fine and accurate? So you tell them that we have a control. Every day we're taking a sample with the high control, and then we're measuring it on the machine, and then the low control and measuring it on the machine. And if it's between the range that's on the reagent, the control reagent, then we're on the safe side. That's our answers. So here are the same questions for the doctors, but maybe there's a little bit difference with consultation procedure between specialists. That'll be if you have a case that needs attention from another clinic, so the patient's being transferred with a consultation request, and the consultation request is in the form. It should be filled in, ask the question by the other clinic, and then return the form to the same doctor again. Safe prescribing of medication. I showed you earlier in the video before that about the drug formulary and the antibiotic guidelines. Please go back to that. Turnaround time, we spoke about it. Informed consent. Anything you want to do has to be signed. Like for minor surgeries, you have to be signed. AMA against medical advice has to be signed. Transfer patient outside facility has to be signed by the patient and the doctor. Family and patient education. Patient has to be aware of his case. What's the procedure taking in his diagnosis? What are they going to do as a care plan? He has to be well educated, and this education is being printed out in his information form that the patient has been educated with his case, and he knows exactly he's been educated with what the procedure is going to be. We spoke about this one, about the cardiopulmonary arrest, reporting of medication error. If any medication error, all you have to do is an OVR and mention what happened to it so we can take action. Disclosure of patient and family following incidents. Patient has to make sure that if any bad news, he has to know exactly the truth, whether this is up to the doctor to evaluate if he's mentally well, to accept the news. So they go ahead further with the news to the patient. What to do in case of fire, effectiveness of point of care testing, knowledge and clinical practice guidelines. This is some doctors have been asked to write some guidelines about certain medical issues, and that's already been fulfilled by some of the doctors, not all. Thank you all for listening. Take care. Bye-bye.